I'm of the view that if we want to do this right, we kind of need a Manhattan Project for primary care. Welcome to Office Hours with Dr. Saini. I'm Vikas Saini, president of the Lown Institute. In this series, I give you my honest take on the US healthcare system, one question at a time. This week's question is, how can primary care models or movements make healthcare more affordable? Well, the thing about affordability in primary care is that almost everywhere in the world, what's been shown is that a robust, comprehensive primary care system is really the bedrock of an affordable healthcare system. That means primary care needs to be kind of in the center. That's the linchpin of a good delivery system. I mean, the real challenge, of course, in the United States in terms of how to get there from here is that primary care situation in the country is really pretty weak and deteriorating in many ways. There's a model of primary care as being one module inside a large hospital system, along with all the specialists and all the ancillaries and all the other dimensions of modern care. And I think that actually recreates the problem. It recreates the power imbalances, recreates the money imbalances, and doesn't really alter the trajectory of how both the funds flow, how care is managed, even if people doing this have the best of intentions and want to, quote unquote, empower primary care. So I think that's actually one of the dilemmas, and that's why, at least in our upcoming conference, we'll hear from a primary care doc who sitting inside a large delivery system has decided there's no way, no path forward without unionizing doctors. There are, broadly speaking, two flavors, if you will. There's the old sort of original model of concierge care, which conjures up images of the old carriage trade, and you're the plastic surgeon to the stars in Hollywood, or you're taking care of a very elite group, and you charge those kinds of concierge fees, like $5,000, $10,000, $20,000 a year, just for the privilege of being able to talk to you. I mean, I have trouble with that, but that's the old model. But the newer model is more like a subscription, and everybody's into subscriptions. Who doesn't like that? Amazon loves it. Apple loves it. Everybody gets a reliable revenue stream through subscriptions. Even the subscription model is on top of whatever somebody's paying for their healthcare insurance coverage, assuming it's a bolted on primary care. So I think it's absolutely not a solution unless it's scalable and the workforce is scalable and it fits into the rest of the system. So my own view is that we have to figure out how to have primary care in a functioning delivery system that provides all the professional satisfaction and ease of use and all the other pieces of the puzzle that direct primary care, aims to solve and does solve for a small group of people. We need to think about and design and engineer for that for the entire delivery system. What's really difficult about the United States is when you look at other countries that are doing primary care, or a greater portion of the premium dollars going to primary care, and you can see the robustness of the primary care, and you can see the lower spending overall. The hard part is that much of this depends on initial conditions, how you set things up initially, and in what ways it evolves. Really is a strong determinant, and that means to start where we are, in which we're very specialist dominated, where primary care is, under siege or maybe even withering. I don't know if that's not too strong a word, but to imagine revival, renaissance, and even transformation makes it that much harder. I think where other countries have done that, they've done it because they're starting at their starting point. They already had that perspective. So I don't think we can sugarcoat that. I think the challenges are enormous. At the heart of this, of course, is the question of what is the product of healthcare? Is it health, or is it a procedure, a vaccination, an event? And quite clearly, most people, for themselves, their families, don't want it to be transactional. They want to be understood. They want to be known, and then they want good advice. I'm of the view that if we want to do this right, we kind of need a Manhattan Project for primary care. And the numbers, last time I did a back of the envelope, the numbers seem big, like 100, $200 billion. But relative to the kind of money we're spending for all sorts of things, it's actually not that big. And the payoff, the ROI, is pretty damn significant. Well, that's all we have for today. So we'll see you next time.